Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us now is Dr. Adam Kramer. Thank you so much for calling in with us today. We always have great information from you. We love it when you call in.
Very welcome.
Okay, so today we're talking about minimally invasive spine surgery. So how does that differ from traditional spine surgery, doctor?
Well, nowadays I have access to a lot better technology, newer technology that enables me to do a much more focused or precise surgery. In fact, I'm able to repair the spine through an incision a lot of times that's smaller than an inch, using a tube that's smaller than my index finger. And so this enables me to access the spine through a much more precise way.
Doctor, a lot of people have this question. So how do you know if you need surgery to relieve back pain?
Well, we work very closely with your primary care physicians to help determine that. Many people get better without surgery, and so we closely coordinate that care. But if a patient continues to have a lot of back and leg pain and symptoms that radiate down the leg, a lot of times surgery is required, and that's when I get involved.
And doctor, can patients just say themselves, well, hey, I want to have minimally invasive spine surgery? Can they just choose that?
A lot of times, we have a consultation with the patient, so I'll see the patient, review their MRI with them, and make sure it's right for them. But unlike traditional surgery where a big midline incision was made, a lot of the spinal bony elements and muscle tissue had to be removed in order to access the disc space or unpinch the nerve. But with minimally invasive spine surgery, I'm able to leave all that good tissue and only remove the problem. In this way, I can repair the spine without weakening the spine. You see, that's a big difference. Traditionally, we had to decompress and remove bone and remove muscle, and that weakened an already weakened joint, right? I mean, why did the disc rupture in the first place? Why did the bone spurs develop in the first place? Usually because the joint was already weak. So doing a surgery that strengthens, that adds, that restores, makes a big, big difference. And so I'm able to help a lot more patients out, even patients that may be older or sicker or way too much. I'm still able to help them because I'm not weakening their spine.
That's a huge plus, a big advancement. We love to hear that. Doctor, now, we know the pandemic has affected so many things in our community now. How has COVID-19 affected the conditions of the patients that you're treating?
Well, this is essential. This is what's such a big advantage at McLaren. We have a team-based approach, so I work very closely with the medical doctors to ensure that the patients are safe to undergo surgery. But most importantly, we work closely after surgery to make sure the recovery is safe. And one of the beautiful things with minimally invasive surgery is that a lot of these surgeries are outpatient, so patients aren't required to stay in the hospital and be exposed.
Wow, we learned so much today, doctor. We appreciate you calling in for this valuable information. We really needed to hear this. Thank you so much.
You're very welcome.
Okay, stay safe and be well, doctor. You're welcome. If you'd like any more information, please head on over to the Aging and Style page. That's on WNEM.com.